Hey everybody, Dr. Deom here at Hazleton, Stroudsburg, and Pottsville Eye Specialists. Yes, I am so excited to finally announce Pottsville Eye Specialists. We're in 3 wonderful locations here in Hazleton on the airport Beltway. You can give us a call at 570-453-2020. In Tannersville, Stroudsburg Eye Specialists, give us a call, 570-421-3342. And our brand new location in Pottsville, we are so excited to be offering a new location to help all of our patients in the Schuylkill County area. Very conveniently located on Bacon Street. It's 541 Bacon Street, Pottsville, PA. You can give us a call there already also, 570-628 EYES, E-Y-E-S, yes, 628 EYES. So give us a call. We're already scheduling appointments for early December, late November, and we would love to get you scheduled for an appointment in our brand new location in Pottsville. Wonderful area to park, easy access into the building, brand new state-of-the-art equipment, totally refurbished building. Very excited to be offering our services in the Pottsville and Schuylkill County region. So I'm really excited to talk to you today from our studio here in Hazleton about something that is affecting many eyeballs around the world and in our community. It's called myopia. And you may have heard of myopia before because it is one of the most common eye conditions that we deal with on a daily basis. It's more commonly known of as nearsightedness. And you may think of nearsightedness as being a relatively benign condition. It is something that doesn't necessarily cause any real problems. And if you thought that, you would actually be wrong. Nearsightedness definitely has a significant impact on one's life. It can cause all sorts of different things. And one of the biggest issues that we have with nearsightedness, in other words, the ability to see up close, being able to see near better than far, one of the biggest issues with nearsightedness is that it is dramatically increasing in its prevalence in the United States and across the world right now. In fact, in 1970, only 20% of the population, and in particular school-age children, were nearsighted. And fast forward to now, several years later, 50 years later, it's double that, more than double. It's 40% of the population, 40% of school-age children have developed nearsightedness. Now, what does that mean? Well, it's telling us a couple different things. It's telling us that there's been a change in our population, a change in maybe activity. Certainly we know that young men and women and adults are doing this a lot more. They're on their cell phones, tablets, and computer screens a lot more than usual, and probably replacing what we did before with that. And what did we do before? We went outside and we played. We had some good old-fashioned fun and was running around outside. Now, we're not really sure what the causative factor for why people do develop nearsightedness is, but we know one thing is true, and that is that people's nearsightedness is dramatically increasing. It's changing at a rapid rate. And so we don't know if it's the genetics. Certainly we know that genetics play a large role in developing nearsightedness. For example, if 2 parents are nearsighted, then there is a 30% chance that their child will have nearsightedness. If 1 parent is nearsighted, there's around a 20% chance of nearsightedness. And if no parents are nearsighted, there's still at least a 10% risk of nearsightedness. So it's always present in our population, whether your parents are nearsighted or not. Certainly, again, both parents are nearsighted, definitely a much greater risk. 30 to 50%, the studies say, that the child of 2 parents that have nearsightedness will be nearsighted, 30 to 50%. So genetics is one potential source. Another potential source is our environment. Okay, so our environment. So this is getting to the way that we're living right now compared to maybe what we did do and maybe what some other people do more often. And that is playing outside. And so we know that environment plays a major role. What we've yet to show is that using electronic devices has a causative role. But what we do know is being outside has a positive role in reducing the rate of developing nearsightedness and in reducing the rate of nearsightedness getting worse. So we don't know if that's being outside in a larger area, if it's vitamin D coming from the sun that's actually stimulating or halting the progression of nearsightedness, or there's actually been some studies that show that dopamine release in the retina caused by sunlight can actually reduce the elongation of the eye, which is ultimately what causes nearsightedness. So environment is another really big one. Another is diet, exercise. Diet and exercise, a healthy diet can actually lead to reduction in nearsightedness, and exercise, again, kind of piggybacking on that outside, being outside more and reducing the rate of nearsightedness. So why do we care about this anyway, right? You just get glasses and contacts, and we're providing glasses and contacts for people. So boy, I probably should be on here saying, don't worry about all this, go and get nearsightedness and we'll fix it. Well, that's not what we're doing. We care about you and we care about your eyes, and we know that when it comes to nearsightedness that there are some negative consequences. Some of those negative consequences can have serious long-term irreversible health damages that occur to the eye, and some of them have to do more with the ability to do certain things as we age, and even our comfort and courage and self-confidence that we develop throughout the course of our life. So those are the consequences of nearsightedness, and we're going to talk about them in a little more detail on the other side of the break. Hey everybody, Dr. Deom here at Hazleton Eye Specialists. We're here with another exciting episode of Eyecare today. So happy you tuned in. We're talking about nearsightedness. And before we jump into getting back into the topic, I'm gonna just run down all of our beautiful locations so you know exactly where we're located and where you could get the best eye care in our region. So Hazleton Eye Specialists, of course, we're on the airport beltway at the Big Eyeball. You can't miss it. 281 Airport Road, Hazle Township, PA. Give us a call, 570-453-2020. We're also in Tannersville, Stroudsburg Eye Specialists, right behind the Friendlies on Route 611 in Tannersville. Can't miss us there. Beautiful new location there in Tannersville, 570-421-3342. And, drumroll please, Pottsville Eye Specialists, our brand new location. Very excited to be entering into Schuylkill County, providing an area that I think is really has an unmet need for healthcare, and we're very excited to be entering into that community. I feel like I'm an honorary Schuylkill County resident. My wife is originally from the Williamstown area, Williams Valley, down Tremont, Tower City, that area, so southern Schuylkill County. But to be honest, growing up here in the Hazleton area, I didn't know much about Schuylkill County, and she's given me an education on it. And her family, they have extended family in Coltmont and Mount Carmel, and so I've come to know and appreciate and really love and respect the people of Schuylkill County, and good, hardworking folks that really deserve good quality eye care. So we're very excited to be entering into the Schuylkill County region. Beautiful new location on Bacon Street, 541 Bacon Street, right behind the old hospital there, 541 Bacon Street. Beautiful location, totally renovated. Give us a call there, 570-628-EYES, EYES. And we're going to be scheduling appointments there late November, early December of 2020. give us a call. We're going to have Dr. Brendan Connors, a great new, very competent doctor, wonderful guy, great bedside manner. I think you'll really like Dr. Brendan Connors. And I will be there as well a couple days a week to help out with some of the patient overflow. Hopefully we'll see you there. So we're today talking about nearsightedness and myopia, which means being able to see better up close than far away, something that we traditionally correct with glasses, contacts, or even LASIK. And so we're talking a little bit about how nearsightedness has changed over the course of the last several decades. So in 1970, nearsightedness was only 20 to 25% of the population. Fast forward to today, it's around 42% of the population. It's actually projected in 2050 to be around 58 to 60% of the population. So a huge shift in demographics, and a lot of different reasons why we believe that is, and we've talked about that in the previous segment. So what are the consequences of nearsightedness? Well, like we've pointed out, and like many of you know, it's job security for me, right? Obviously glasses, contact lenses will get you seeing better, and oftentimes we fall short. Eye care providers fall short in really educating you on the consequences of nearsightedness. And so what is going on with nearsightedness? So what we think about nearsightedness, you can see this picture of the eye, where this picture here is an eyeball that does not have nearsightedness. And you can see the picture now, this is an eyeball that does have nearsightedness. And you could see the difference between the two images. The image with the eye that does not have nearsightedness, you could see where the light is coming into the eye and focusing right on the retina. And you can see the image of the eye that has nearsightedness, the light is coming in and it's focusing before the retina. That is because the eye has elongated and stretched. And so as one's nearsightedness changes, typically in their adolescent and teenage years, what's occurring is the eye is literally elongating. And there's consequences of that. The consequence of that, of course, is that the retina is stretching. And in stretching the retina out, we are at a much greater risk for things like retinal detachment, which in the normal population, the risk of retinal detachment is only 1 to 5%. It increases to approximately 20% if your nearsightedness is over what we call 6 diopters. So diopters is the unit of measurement that we use to measure people's prescriptions. So if your unit of measurement is over 6 diopters, and some of you may be familiar with what that is, your rate of retinal detachments increased to nearly 25%. 1 in 4 will experience some form of retinal problem. So retinal detachments, that's number one. Number two is something called myopic maculopathy. Myopic maculopathy is often misconstrued or misdiagnosed for macular degeneration, very similar type of condition where we actually have a loss in the retinal integrity in the very center part of the back of the eye, an area called the macula. So this is something that doesn't show up until later in life, but myopic maculopathy can be decreased by about 90% if we had folks that were -6 or greater that never got to that level. If we had some magic way to decrease the way that people end up with more significant levels of nearsightedness. So myopic maculopathy is another condition that occurs as myopia and nearsightedness gets worse. Another that you may be familiar with is glaucoma. Glaucoma is a condition that affects the optic nerve, and it takes away your side vision. And it causes irreversible blindness in a painless way. And we have great ways here at Hazleton, Stroudsburg, and Pottsville Eye Specialists to diagnose glaucoma and ultimately treat it. And we are very, very proud to be offering really the highest level of glaucoma care and the connection to surgical care if we need to do so. However, we'd much rather you never got glaucoma in the first place. And so one way that we can do that, again, is potentially to have some magic thing to reduce the rate of nearsightedness and myopia progression as time goes on. The last thing that I'd like to talk to you about that is caused by nearsightedness or is much higher has a much higher correlation with nearsightedness is cataract formation. Cataract formation certainly is more pronounced and happens earlier in folks that have nearsightedness. So myopic maculopathy, glaucoma, retinal detachments, and cataracts are all forming at a much higher rate in folks that are nearsighted than folks that are not. And it would be great if we had some way to reduce the rate and progression of nearsightedness or reduce the rate of myopia in and of itself. We know that it's progressing over time, and would you believe it or not, there is actually something out there that we now have access to, the first FDA-approved treatment for the reduction in the progression of nearsightedness. And I'm really excited to tell you about it. So don't go anywhere. Hang on, and I'm going to tell you in just a few moments after the break a little bit more about something called myopia control. See you soon. Hey everybody, Dr. Deom here at Hazleton Eye Specialists, our studios here on the airport beltway and our office. You can't miss it. It is by the Big Eyeball, Hazle Township, PA, 281 Airport Road, Hazle Township, PA. Give us a call, 570-453-2020. We're also in Tannersville, Stroudsburg Eye Specialists, a beautiful new location behind Friendly's on Route 611, right down the road from the outlets. So go shopping at the outlets and come on and get your eyes examined. Wonderful location there, now accepting new patients. So give them a call, 570-421-3342. And also, drumroll please, Pottsville Eye Specialists, now serving the Skook. I will lovingly refer to it as the Skook. Wonderful people there in Schuylkill County, the anthracite region. Very excited to be entering into providing care in that area. We have lots of patients that travel up north here to Hazleton from that area, so we're happy to be able to provide them that care without the travel. So give us a call there, 570-628-EYES, EYES. We're now scheduling appointments for late November, early December of 2020. Give us a call and we'll set up your appointment, get your care established there. Very exciting. So we are here today talking about the myopia pandemic. Yes, I know, another pandemic. You don't want me to talk about that, I'm sure. But myopia is a major health concern, a major public health concern, because it has dramatically increased over the last 50 years from around 20% of the population to now 40% of the population. It has serious health complications and risks that can occur as a result of increasing nearsightedness, like things that we talked about in the previous segment: retinal detachments, cataracts, myopic maculopathy, a form of macular degeneration, and also cataracts. And then lastly, I think that it's important to note, and I think this is an important thing that parents of children that have nearsightedness should understand, is that being nearsighted affects the way that children learn. It can. If they're not able to see the board, it could affect their confidence. If they're not able to, swing and hit a baseball, it can affect the way that they enter into certain careers. If they're not able to accurately read letters on the eye chart and maybe not go into flight school, it can affect their ability to access LASIK at some point in their life. If they're too nearsighted, it may not be a safe candidate for LASIK. And so there are reasons why we may look to find ways to decrease the incidence and progression of nearsightedness. And all too often this is something that we just look at as it's just a consequence of my genes. It's something my parents had and I'm gonna have it too. They went to the eye doctor every year and their prescription got worse, and that happened throughout their entire teen and adolescent life, and that's what's going to be for me also. Well, we now know that that's not the case. So we have a couple different ways that we can actually do something called myopia control. And so the first thing that we need to understand is that we believe that myopia, or nearsightedness, is the change in the length of someone's eye. And that by changing the length of their eye, it getting longer, we get more nearsighted. And that also increases the risk of all these bad things that could happen to the eye. And so we believe that certain lens types, there's two that I'm going to talk about, certain lens types can decrease something that we call peripheral defocus. And so this is a picture of what peripheral defocus is. It's the blurriness that occurs on the side of the retina when we put a lens in front of the eye to correct nearsightedness. So what we normally do to correct nearsightedness also creates a stimulus for the progression of it by this idea of something called peripheral defocus. And you can see that in this picture. And so what we know, though, is that certain lens types can get rid of this peripheral defocus and decrease the stimulus for the progression in nearsightedness or the elongation of the eye. One is a hard lens that you sleep in at night. It's called orthokeratology or CRT, or corneal reshaping therapy. This is something we offer here at the office. It's a lens you sleep in at night, take out in the morning, and you don't need glasses or contacts throughout the course of the day. Very exciting lens technology. We love it, and it reduces the rate and progression of nearsightedness by approximately 50%. Very, very exciting, and something we've been doing here at the office for the last 5 or 6 years. We offer this in all our locations. Orthokeratology, or Ortho-K, great way to treat this. What I want to talk to you about a little bit more is a new soft contact lens. It was actually just released a few months ago. We are going to be the only office in the area to be offering this lens. It's called MySight. I was just certified to provide this lens. I had to go through some classes and also take a test and be certified to be able to provide this lens. And it's called the MySight Daily Lens. It's the first FDA-approved lens to reduce the rate progression of nearsightedness for folks that are nearsighted. So what they found was that if you were between the ages of 8 and 12 years of age, and we provided you this daily disposable contact lens, a lens you wear for a day and then throw away at the end of the day, that it reduced your rate in progression of nearsightedness by approximately 59%. It reduced the rate in elongation of the eye by approximately 42%. What they also found was that the rate of complications from contact lens wear, in other words, when you wear a contact lens, we do take on certain risks. We take on the risk of eye infections that you maybe wouldn't have when you wear glasses. They found that the rate of eye infections in this group of children, 8 to 12 years of age, kids that, maybe aren't even good enough at washing, their teeth at night or cleaning their room, their rate of infection was significantly lower than studies that were done in populations that were in their teens, 20s, and 30s. So this population took better care of their lenses. Maybe it was their parents helping them out, but the rate of infection was significantly lower. And ultimately, their confidence, their ability to see clearly, and their self-awareness was also improved by some studies that were done of this patient population. So really exciting new lens modality. It is a soft, daily disposable contact lens. It is a uniquely designed lens that has within it treatment zones that have been shown to reduce the rate and progression in nearsightedness by approximately 59%. So what does that mean? It means that if you're a -1 prescription, when we first start seeing you and you're 8 years old, it means that by age 12, if you were going to be a -4, in other words, you're going to develop 3 more diopters of myopia, you would maybe only be a -2 instead of a -4. Now, what does that mean? It means that you can maybe see your clock when you wake up in the morning, where otherwise you can't. It maybe means that your risk of developing very serious visual consequences when you're in your 30s and 40s is dramatically decreased to the point where it's almost negligible. It means that you're more comfortable, maybe in your 20s or 30s, investing in something like LASIK because your corneas are not stretched and thin and your retina is maybe thinner than what it should be also. So the bottom line is, parents, if you're nearsighted, you need to get your kids in here. Whether or not they are having difficulty seeing the board at school, it's very important we check to make sure that they do not have nearsightedness. And if they do, that we have this very important conversation with you about myopia management. Very excited to talk to you soon, and thank you all for listening to us today on Eyecare Today.